Hi, I'm Dr. Paritosh Gupta, Senior Consultant, Head of Department, General and Minimal Access Surgery, Artemis Hospital. Today we'll discuss about fistula in ano, anal fistula. A very common problem, a lot of people have it and very less talked about because of social innovation. So a lot of people who come across some kind of annoying discharging wound around the anus area, which keeps coming back recurrently, heals and again reappears. If a surgeon examines you, he can very well find out and tell you might have an anal fistula. So next question people come across and ask me, how do we confirm it if it is anal fistula? Meet a physician or a surgeon, get an MRI perineum done. MRI will give you almost 100% diagnosis of confirming if it is an anal fistula or not, and also tell you where it is arising from, how deep it is going, and where it is connected from the inside. Now next question people ask me, why doctor it is not healing up with the medicine, it heals and recur again. Problem with the fistula is small internal communication from the anal area. So whenever you pass motion, some small infection seeps into it, and then there is abscess formation and it bursts out from the skin wound and you have a discharge again. The moment this burst out from the skin area, pain disappears and patient become happy and they again avoid going to a doctor. The problem, because patient don't discuss out with any people or any physician, they are not keen to expose themselves, they don't discuss and they don't get diagnosed. Now next people ask me, doc, what is the treatment if we find out what it is an anal fistula? If we find out on MRI, how are we going to treat it? Now anal fistula has got a communicating tract which need to be removed. So there are two ways of going ahead from here onwards. One, either we remove the complete fistulous tract surgically. Second option, we can ablate the complete tract with a laser wire. So diode laser is the latest treatment technology available. We can burn out the tract, bring it nearest to the anal area and excise this thing completely. The advantage of laser, a lot of people ask me, what is the advantage of it? What is the advantage of a conventional surgery? Why conventional surgery is not being used? Why latest you're talking about laser? So laser allows us and give us time that the wound becomes smaller. It is a quick surgery, take about maybe 5 to 10 minutes. The major of the area become ablated or burned out with the laser, so it become squeezed out. Now internal opening has to be manipulated and that has to be cleaned up or closed from inside. That can be done under anesthesia. So complete procedure or a surgery lasts maybe about 10 to 15 minutes and you're good to go home in one day. Now people ask me, doc, how much time I'm going to take a recovering out of this situation? So it varies from person to person. A small fistula, your recovery is too good, you're back to work within a week's time. It is a deep fistula or a complex fistula or a high-end fistula, it may take about 15 days to go back to work. Eventually the complete wound healing takes about 2 weeks to about 4 weeks. But you are good to work because there will not be any pain post laser surgery within 2 weeks' time. So whenever you find out there is a recurrent abscess in the anal area, please consult your physician or a surgeon and get yourself treated. Do not ignore it.